This is the mandible. Think of it as two vertical bones and a horizontal bone that basically then meet at an angle. So the midline is the symphysis, and this extends from the midline to the lateral incisor. The parasymphysis extends from the lateral incisor to the mental foramen. Thereafter, there's a body, and this goes from the mental foramen to the second molar. Then, as we move further, we have the vertical component, which is the ramus, and at its angle, it's the angle. It then forms two important structures. The coronoid process and the condyle with a sigmoid notch intervening. We'll look at the bony landmarks in the internal aspect. This is the better side. On this aspect is the mandibular foramen, which has a lingula that protects it, and then here is the myhyaloid line, and underneath this is the submandibular fossa, the sublingual fossa. It's also the fossa of the digastrix, and superior to it are the meatal spines, which are superior and inferior. Then I like to talk about the muscles that attach all to it. And firstly, there are the muscles of mastication. These are important, as firstly the temporalis muscle comes from the temporal fossa and attaches to the coronoid process. The ramus and angle on the external surface has the masseter muscle, which then goes on to attach to the zygomatic arch. Then on the inner aspect is the lateral pterygoid that attaches to the pterygoid fossa and the inner condyle, and that comes from the lateral pterygoid plate. And on the inner angle is the medial pterygoid, which also comes from the lateral pterygoid plate with the medial side of it. I then go back onto my muscles of facial expression, which are important, and then we come down the anterior oblique line, so where the buccinator attaches and then goes on to form the modiolus. The mentral protuberance, which you can see here. It's where mentalis goes up and then attaches the lower aspect of the skin to the chin. The oblique ridge that then goes across is the depressor labii inferioris, and below this is the depressor anguloris. On the inferior border is the platysma. The depressors, which are important to have a look at, are the mylohyoid, which attaches along the mylohyoid line and then goes on to form a sling at the midline, and then the anterior bellies to the gastric fossa, which is the anterior belly of the muscle digastric, which is supplied by the nerve to mylohyoid. And then the superior meatal spine is the genioglossus, that goes up to the tongue. The inferior meatal spine is geniohyoid, then comes down. We've already mentioned the mandibular foramen, where the inferior alveolar nerve, which is a branch of the posterior division of the trigeminal mandibular branch, comes off and then gives that branch to mylohyoid just before, protected by the lingula, and that's how you do a BSSO, when you find that and then make your cut anterior and then along the oblique line through that side. The mental foramen that comes out basically passes the exit to the mental nerve, which is the end terminal branch of the inferior alveolar branch, and there's also an incisive nerve which goes in towards your canines and supplying the incisors.